Hello, my name is Dr. Bob Perkins, and I'm a dentist in Malibu and in San Diego. I'm a TMJ dentist primarily, and I also deal a lot with sleep issues and facial development, and that's kind of my focus, is getting jaws and faces to develop properly, and as well as treating TMJ and sleep. So today I want to talk about something that is incredibly important to our health and wellness, okay? And I'm going to talk about 4 things that are directly impacted by our facial development and our bite. So we all have a bite, right? So we understand what that is. So 4 very important things that are so foundational to health and wellness and aesthetics. And I think the medical and dental community isn't really in tune with this as much as they should be, because it's so important. Here are the things that are all tied into the bite and facial development. One is whether or not you're going to have TMJ problems. Now, TMJ problems are very common. A high percentage of people have them, women more than men. It comes about as a result of typically having a bite where the muscles have to overwork excessively in order to bring the teeth together. So those muscles, because of the bite you're in, are overworking. The jaw muscles, they get fatigued, then the head muscles try to help out, they get fatigued, the neck muscles get fatigued, they try to help out too, and they get fatigued. You get ringing of the ears, you get dizziness, ear congestion, clicking in the joint, all kinds of things fall into that category. TMJ can be extremely debilitating, and it's a major problem. Another thing, which is major, is these are all related to facial development and your bite. Sleep apnea. Sleep apnea is one of the most pervasive health issues that we have existing now. If you have sleep apnea, very simply, you're not going to live as long. Your quality of life is going to be inferior to someone that doesn't have sleep apnea. You're 23 times more likely to have a heart attack, increased risk of stroke. It's just bad news everywhere. You're not going to fight diseases as well. So sleep apnea, very common. And it's very tied into your bite and your facial development, okay? Next thing is how your face develops aesthetically. So if your bite and your face don't develop the way they should, your facial development is not going to be, you're not going to have optimal balance and proportions to your face. You're going to have a lower jaw that's set back, kind of like a weak chin. It may make your nose look larger. You might have an overly compressed face as a result of that, so your lower face is kind of shorter. Think of, like, say, Putin. He has an incredibly compressed face. Best example I can think of. Your teeth won't develop in the right position, so your teeth will be angled back. They won't show as much. So facial aesthetics, and there's a lot more stuff that I'll talk about, the way your skin ages and so forth, that I'll get into later on. But so facial aesthetics, tremendously tied into your bite and your facial development. And then another big thing for children, especially, if their jaw's set back and their face doesn't develop properly, they're much more likely to develop behavioral issues due to the fact that their breathing they're going to have sleep disordered breathing, is what it's called. And it's kind of similar to sleep apnea. It can actually be just like sleep apnea, where oxygen is not going to be distributed into the organs and the brain well. During sleep, you're going to get not proper oxygenation, so the battery's not going to recharge, which is what sleep's all about, recharging the battery. And so because of that sleep disordered breathing, that child is going to develop, in many cases, is much more likely to have these problems, behavioral issues, which are ADD, ADHD, depression, anxiety, lower cognitive skills, difficulty learning, permanent lowering of the IQ, bedwetting, all kinds of things, big things. So when you see a child that has their lower jaw set back and they look like they've got smaller jaws and they're mouth breathers, and they also have these issues like ADD, ADHD, maybe they're having trouble learning, you don't just go give them medication. You step back and you look at the forest and you go, hey, let's address this person's breathing, their bite, and let's get that airway opened up, and let's see how they respond. You don't just start giving out medication, which is kind of the medical thing we do. So sleep disorder breathing is a big deal. Let me talk about the bite. And kind of give you a brief idea of what I'm talking about with the bite. What affects the bite, right? Because I'm talking about if the face doesn't develop properly and if the bite doesn't develop properly, then we can definitely have a much higher likelihood of these problems. So our bites are not determined genetically, like let's say like our eye color, our hair color, our height. Those things you cannot influence. No matter how you live your life or where you grow up, what foods you eat, you're gonna all have the same, you're gonna have the same eye color and hair color that you were programmed to have. It's not the case with your bite, okay? Your bite is uniquely and very susceptible to environmental and developmental influences, okay? The biggest influence on your bite and how your face develops is whether or not, and this is one I'd write down, this is probably the most important thing I'm going to say throughout this entire talk. The most important thing for facial development and developing a proper bite, which all affect those other 4 things I talked about, is whether or not you're breathing through your nose with your lips together, or whether you're a mouth breather. And if you're a mouth breather, things are going to go downhill. I can show you the face of somebody who's a chronic mouth breather and someone who's been breathing through their nose with their lips together, and the faces are going to look incredibly different. Their health is likely to be very different. One's going to be more likely to have these issues that I talked about, and the other one's probably not going to have those issues. So the most important thing we can do, starting with childhood, if we have children, is to make sure that our children can breathe through their nose properly. Breathing through the nose is so superior to breathing through the mouth. I can't emphasize that enough. So let's talk about just the air quality difference between breathing through the nose and breathing through the mouth. First, let me say the reason people don't breathe through their nose is because they can't. Their airway is blocked in some way. So the default for everyone is to breathe through their nose, right? That's the natural thing. But sometimes due to allergies, deviated septums, tonsils, enlarged tonsils, adenoids, it's going to be difficult to breathe through the nose. And so the default is, okay, they're not going to think about doing it, but they're just going to open their mouth and go, hey, I can get air in this way. So they end up breathing through the mouth chronically. And that really makes things fall apart. So breathing through the nose is crucial. And the air quality you get when you breathe through the nose is incredibly superior. Here's what I mean. So if you're breathing through the nose, the nasal sinuses release something called nitric oxide into the air that you take in. That nitric oxide increases the oxygen saturation in the air, so you get a higher oxygen content, oxygen saturation, which is very important. That's what we need, oxygen. That's the most important nutrient in the body. It also, this nitric oxide also releases antiviral, antifungal, and antibacterial components into the air. So we're taking in these incredibly important components into our air that fight all these problems that might confront us. Also, when we breathe through our nose, we get a much higher, more positive pressure when we breathe through the nose. So the air goes down into the deepest parts of the lungs. When we breathe through our mouth, it's very shallow. It's just air gets into the top of the lungs only. When you breathe through the nose, the air is filtered and it's warmed, and when you breathe through the mouth, it's not. It's breathing through the mouth is, think of it as like it's garbage. It's like a garbage way to breathe. So you want to do everything you can, starting with your children. Observe them when they're sleeping. Make sure they don't have any disruptions or their breathing seems labored. They're making sounds like snoring sounds. Take them to the ENT. Take your kids to the ENT at a very early age. Make sure they don't have any upper airway obstruction. Okay. So you want to get at that. You do not want to develop chronic mouth breathing, because that's going to just make everything fall apart. So here's what happens when you breathe through your nose. The good things that happen when you breathe through your nose. When you breathe through your nose, I mentioned the air comes through and it's assisted with the nitric oxide and all those good components, higher oxygen saturation. When your lips are together, which is how when we breathe through our nose, our lips are together, right? When our lips are together, then our tongue is typically up against the roof of our mouth, okay? Now, the tongue being up against the roof of the mouth is absolutely crucial, because the tongue is like the world's greatest orthodontic appliance. And if you see somebody on the street, you can tell if their tongue is postured up against the roof of their mouth, which it should be in everybody unless they're eating or sleeping. So think of it this way. The tongue is this big muscle. It's shaped like a horseshoe, right? And the tongue, when it's positioned properly up against the roof of the mouth, it ensures that the teeth are going to be outside of that tongue. So the teeth there's going to be plenty of room for the teeth. They're not going to come in crowded, because those teeth are going to come in outside of the tongue. The tongue says, listen, here's my space. I need this space. I'm the big tongue. You're going to come in around me. And when those teeth come in around that tongue, they're naturally positioned optimally, such that they're forward in the face. They're not set back. The angle of the front teeth is, there's a certain angle that's most aesthetic, where the light hits it best. And you get this full smile, which is aesthetic, instead of a narrow smile, which allows plenty of room for your lower jaw to come forward. And so all these things take place. As a result, they can't take place if you're a mouth breather, because when you're a mouth breather, what happens? You open your mouth and immediately the tongue drops to the floor of the mouth. And then everything kind of goes to pot. The upper arch then isn't able to have the tongue to develop it, so the arch narrows. The arch starts to narrow, the teeth start to crowd, there's less room for the tongue, it affects the bite, and everything falls apart. So again, reemphasize, make sure your child can breathe through their nose and with their lips together. There's also therapists out there, myofunctional therapists, which are trained to take children and adults and to assist them into getting these proper breathing patterns with the lips together and the tongue positioned properly. They're amazing. It's an amazing specialty, and they do so much to help me get my results. I'm going to kind of break down the 4 things that I brought up initially that are affected by the bite, and kind of go into more detail as far as how it plays out. So let's talk about the TMJ factor. Okay, so TMJ, which I treat constantly, all the time in my office, TMJ is caused by muscles overworking. Okay, muscles are working excessively, and that translates to chronic headaches, jaw pain, neck pain, joint pain, clicking, ear congestion, tinnitus, dizziness, all those things. So typically, a TMJ patient is going to have a bite that requires their muscles to work excessively in order to bring their teeth together. So I'll oftentimes see an overbite, a profound overbite in patients that have TMJ, such that I know their lower jaw is being asked to pull back too far in order for the teeth to come together. So we all have a bite. I mentioned that our bites are not really genetically determined, like our eye color and so forth. Well, we're going to close down in our whatever bite we have. You know, if I can make your teeth come together in any number of places, and that's where you're going to learn how to close down, because they fit together like gears. Where else are you going to chew? So a person with TMJ is going to have a bite which has kind of been an adaptive bite. Their body is modified due to all this chronic mouth breathing, such that their lower jaw is now back from where it should be. The teeth are now touching in that place. That's their bite, but muscles have to work excessively in order to bring the lower jaw into the bite. So those muscles get fatigued over time, and then it's just a cascade of things happening. So to treat that patient, you can do this non-surgically. You can change the bite, put the patient into a bite position where the muscles don't have to overwork in order to bring the jaw back. And then we expect all the muscle symptoms to go away, because now the muscles aren't overworking. Just like if you were to walk into a room and your arms were like this, it'd be obvious to somebody saying, listen, why is this guy, he says he has sore arms and shoulders, but his muscle, he's walking in the room like this. Well, hey, let's just relax your arms and see what happens to your symptoms. Same thing with a bite. The bite has a very, very strong relationship with TMJ. So, and your bite, as I've established before, has an incredibly strong relationship to whether you're a mouth breather or a nose breather. So your facial development and your bite will greatly impact whether or not you have TMJ. You don't see people with TMJ if they have these nice full jaw structures like Robert Redford or Julia Roberts or George Clooney, for example. You don't see TMJ with those people. You see TMJ, there's a certain facial look to it. Jaws are back, weak chins, so forth. So now let's switch to sleep apnea and how it's impacted by your bite and your facial development. So in sleep apnea, you have basically air that is cut off. You're not getting oxygen into your system when you're asleep. So when you're sleeping, you have your airway, and that airway should be unimpeded. It's delivering the most important nutrient in the body, oxygen. Nothing competes with oxygen, not water, not food. Oxygen is paramount. We have to have it all the time. So when that airway gets pinched off the way it would if with a garden hose, let's say we're out gardening and we're watering, and then the hose gets crimped up, well, then trickles of water come out. That's not very good. That's similar to sleep apnea. You're not getting air in there. Sleep apnea greatly affects your quality of life. It is a serious medical condition because you're interrupting air to your brain and your heart and your body. A couple things contribute to sleep apnea. One is obesity. If you're obese, you have a lot of weight around the neck, and that weight, that gravity, can compress the airway. So that's one thing. But I see a lot. Most of my sleep apnea patients are not overweight particularly, and their sleep apnea is a result of their lower jaw being back. So imagine you're lying down on your back. Your lower jaw is back more than it would be. Because of that, your soft tissue, your soft palate are kind of sagging into the airway. You don't have enough tongue space. I talked about what mouth breathing does to your tongue space. You don't have enough of it. And so that will compress and impinge on your airway. So that'll make you more likely to develop sleep apnea, sleep disordered breathing. And you're just not going to live as long if you have sleep apnea. You're not going to fight disease as well. It's so important to keep the airway as maximum as it can be. I mean, I know that there's a direct relationship between all these things like fighting diseases and living longer that are related to keeping that airway open. Sleep apnea is bad news. So that's connected to your bite and your facial development. The fourth thing, which is aesthetic, and we all know aesthetics is very important to people. So if you're a chronic mouth breather, and your jaw drops back and your face is more compressed, all the things that we've talked about that can result as from being a chronic mouth breather and having smaller jaws, then you're not going to have a chin that's in its optimal position. Your profile is going to be set back. Your chin's going to be set back as a result of that. And that will make your nose look larger too. So your face won't be as balanced and as proportional as you might like it to be aesthetically. I'm going to show you a picture here of a patient I treated in New York, and she was 9 years old when I first saw her. She was a chronic mouth breather. In the photo you'll see her lips are open, her jaw's back, chronic headaches too. So I brought her lower jaw forward to improve her breathing, but then because her upper teeth were set so far back, because that often is a problem too, upper teeth are set too far back, and I moved her upper teeth forward because her permanent cuspid teeth weren't even able to erupt. There wasn't any room for them. They were impacting the bone. Moved her upper teeth forward, and then I brought her lower jaw forward, and now you'll see there's an intermediate photo, and then there's the after photo, and her lips are full, her face, her upper face, it's just, the balance is amazing. She looks like Beyonce in the last photo, and her cheekbones are full. You've got to get the jaws in the right place. You've got to get the teeth in the right place so that they look their best. So if you're a mouth breather, if you're chronically breathing through your mouth, let me see if I can demonstrate it. So I did this before. So you're walking around like this, your mouth's open, you're taking in air like this. So there's a pulling down force. There's a pulling down force on your skin because your skin is really just a sac that covers your hard structures. So if you have a smaller hard structure, let's say we were talking about jaws getting smaller, jaws receding, teeth being pulled back. It's kind of like a rosebud effect, I call it. So we want faces and teeth to be like full bloom flowers and not like rosebuds that always stay contracted and pulled in and where there's no space, okay? So we want to make sure that there's enough support for the skin. The skin's a sac. If there isn't enough support for the skin, let's say that the jaw's back, the teeth are back, then the skin is going to fold on itself. It's going to collapse on itself. It's going to wrinkle. Now, plastic surgeons will go in there and they'll say, okay, let's just take some of that skin and cut it away and tighten it on that existing structure. But really, the structure's the problem. It's not in its full primal blueprint. The jaw's not forward like it should be. The teeth aren't out like they should be. So if you bring that patient's jaw forward and get those upper teeth forward where they should be, not only do those teeth look better, not only does that jaw look better, the proportions, but the skin has support, okay? If you don't, here's another thing. So if you're a chronic mouth breather, I mentioned there's really a force like it's pulling down on the skin. So what happens when you see that with people that are chronic mouth breathers, you'll often see that they don't have developed cheekbones. Their cheekbones are very flat. And this is because there's a constant chronic open mouth posture and everything's pulled down. If your lips are together, there's no forces. The forces are balanced by the fact that the lips are touching. But if your mouth's open, you're going to have flat cheekbones. You're going to have in many cases, not everybody has this, but you might see people that have like the tip of their nose is bent down. Well, if you ever see that, it's always going to be accompanied by a lower jaw that's set back as well. So again, it's that pressure, that pulling down, that gravity that's going to make the tip of the nose hook down. So all these things are going to impact negatively on proper facial development. You want good cheekbones, you want strong jaw structures. You don't want skin that's sagging upon itself. And you can correct all these things in a few months. If you're an adult, the best thing to do is obviously address these things at as early age as possible. I talked about seeing an ENT. I talked about a myofunctional therapist. Don't let yourself fall down a path of retractive orthodontics where they want to take teeth out. Taking teeth out it makes the mouth smaller even still, and it's a big deal. We need to look at crowded teeth as a health issue, not just as we got to straighten some teeth. It's not an aesthetic issue only. It's mainly a chronic health issue. It's a breathing issue. We got to look at what's going on. Step back and see the elephant in the room, because that's what it is. When you see all this stuff, crowded teeth, jaws back, open mouth, that's the elephant in the room. We got to see that. So I've talked about several issues, all related to the bite and to facial development. I think that should be one of the biggest things that our medical and dental community should be focusing on. So many things are tied to this: quality of life, longevity, aesthetics. And I can't say enough about the importance of, like I said, nose breathing versus mouth breathing. Don't let that. Also, here's another thing I forgot to mention: taping the lips at night. Some people have difficulty breathing through their nose, allergies. Don't hesitate to tape your own lips or your children's lips. You might find that I've had patients say they slept better than they've ever slept after taping their lips at night, because when you tape your lips together, you know that all of your breathing is through the nose and you're getting all that nitric oxide release, that higher oxygen saturation. And people will say, oh my gosh, I can't believe I slept better because I had better air. So it's not a dangerous thing to do. The idea being that you're going to force yourself to breathe through the nose. There's all kinds of things out there. I'm not going to get into every one of them, but nose breathing over face breathing, and definitely take note of the fact that there are so many issues, health, aesthetic issues, that are so tied to your bite and your facial development. So we want to get that at as early an age possible, but we can still address it as an adult, and we can do it in months, non-surgically. So thank you for listening. I appreciate it, and have a nice day. Dr. Bob Perkins signing out.